Hi, my name is Brian Houston. I'm happy to be with you to share a synopsis of this project I'm doing with Irene Enriquez and Mike Barnett. We're looking at impact evaluation studies of health initiatives by corporations. Although the academic literature and business has generally avoided the evaluation of social impact in corporate initiatives related to corporate social responsibility and social entrepreneurship, there is a significant literature examining the social impact of corporate initiatives outside of business, such as in the fields of development studies and public health. In this project, we seek out and examine impact evaluation studies of health-related CSR initiatives in the public health literature. We compare the nature of the initiative and the methods of impact evaluation used in each study. We discuss these studies, their strengths and limitations, and show how the work in public health points to a way forward for management scholars to jumpstart research using the methods of impact evaluation. In terms of defining social impact, we build off of the logic framework used in development studies and define social impact as the difference in an initiative's outputs that is due to a specific initiative or treatment. So causality is at the essence of this definition. And output is the specific product or result that a given CSR initiative is meant to produce. It could be related to emissions or stress levels or the number of beneficiaries participating in a given program. The kinds of data we use are varied. It can be anything from qualitative data to quantitative data. Most of the studies that we're looking at use experimental designs, and some of them use pre-existing survey data. The measurement of social impact also varies according to the specific intervention. However, the approach to measurement in each case is very similar, identifying a particular desired benefit or output in the study, looking at the outcome, the increase or decrease in this benefit, and then examining the causal relationship between this outcome and the intervention. The ideal approach is the true experiment, where you randomly assign participants to an experimental group or a control group, and you look at the outputs before and after the specific intervention in the case of the experimental group. And the social impact is the difference in the differences in the outputs produced by both the experimental and control group. A number of studies illustrate these points. There's a lot of research on responsible beverage server training. Link et al., 2018, looked at the adoption of alcohol policies and practices in bars and restaurants. The owners and servers participated in a manager-focused responsible service training program, and they found that the proportion of the intervention group with written alcohol policies increased from 62% to 95%. In the control group, alcohol policies increased from 65% to only 79%. There's also a number of studies related to healthy food and convenience stores. Paluda et al. In 2019 looked at the number of healthy items available in corner stores and at replacement purchases by store owners as a proxy for consumption by consumers. Looking at convenience stores, they developed a program to asking store owners to increase the number of affordable healthy foods, providing technical and marketing assistance and even physical improvements to buildings. The results are very promising, and they found increases in healthy items ordered by the store owners, increases in transaction and traffic in the stores, and an increase in consumer attitudes towards engaging in healthy behaviors. Another area are youth apprenticeship initiatives. Reed et al. Did a fairly large study in 2012 looking at employment and earnings of students in these programs that were sponsored by the government but taking place in corporations. And they found significant differences between program completers and non-completers, and between program participants and non-participants in terms of employment and earnings. So these are the kinds of studies that we're finding, and we believe that they're very relevant to our work in corporate social responsibility and social entrepreneurship. If you're interested in learning more, please contact me. There's my contact information. I'd be happy to talk to you offline. Thank you very much.